Hey everyone, welcome back to another intern interview. Today I'm here with Dr. Rob Lombard, and he is a graduate from the Ross University School of Medicine in the Caribbean, and he matched into physical medicine and rehabilitation, also known as PMR or PMNR, at East Carolina University in Greenville, North Carolina. So I usually start these interviews off by getting an idea of why you wound up going to a Caribbean medical school in the first place.
Yeah, for sure. So I myself was a non-traditional applicant. I went back. I had worked in some retail, some management. Ended up doing sports medicine, kind of athletic training. Got me interested, and ended up wanting to go back to school, get my doctorate, and pursue it in a more professional manner. So when I was going through the process, I had to renew a lot of my prerequisites. Sorry. Um, and I think that whole process got me exploring other options. So I looked at the Caribbean. They reached out to give you the option of starting early, getting things moving, and I really liked that. And my family was in a spot where I felt like time was a limited resource. So I applied to Ross, got in quickly, started that year. So I never actually got to go through the US cycle. I think had I gone, I probably would have gone more of the DO direction. I think physical medicine and rehabilitation lends itself a little bit more to that. But yeah, so that's what I'm very happy I went to the Caribbean. Ross was great, and got to meet some really great people. So
Excellent. So, where did you actually wind up becoming interested in PM&R, and where did you, I guess, learn about the specialty? It sounds like a lot of the reason you were interested in it is probably because you were a sports medicine major, you had some athletic training experience, but where did you learn that physical medicine and rehab was actually its own separate subspecialty of medicine?
yeah, so I actually had no idea going back or starting medical school. My whole mindset was to go in and do sports medicine, more so the primary care sports medicine. I think at that point in my life, surgical specialties were out of the picture for lifestyle and commitment. I think at that point, um, and it was around my third year. I was rotating through neurology, and one of the ICU neurologists was sitting down and said, "Oh, have you ever looked at physical medicine rehabilitation?" I was like, "I have no idea what that is," and started looking up, more about it, reading about the specialty. I did my third year of training in Atlanta, so I was at Atlanta Medical Center, and fortunately, the Association of Academic Physiatrists were meeting in Atlanta, so I got to go to the conference. It was kind of I guess serendipitous. One of the first people I met turned out to be one of the chief residents at the program that I match at now, which is ECU Vidant. So I think from there, I just tried to get involved as much as I could. It was definitely late in the game for me, so I had a lot of catch up and makeup work to do. But yeah, so it's kind of how I found out about it anyway.
So, you decided during third year that you were interested in PM&R.
Yeah, yeah.
Okay. Yeah, that's actually really interesting because I recently interviewed someone who was going to pursue internal medicine, wanted to do hematology oncology as a fellowship. And then during close to the end of his third year, he was like, nah, interventional radiology is what I want to do. So then it became like a scramble for him as well. But he wound up matching into IR as well. So that's very great to hear that. Now I know two people who were able to do that. And I think it's important to be able to have your preliminary interest going in. You had an idea you wanted sports medicine, but then you found something that you were a little bit more passionate about, which is pretty cool in itself. What I guess ultimately made you lean in the direction of PMNR specifically, more so than sports medicine?
I think as I learned more about the field, physical medicine rehabilitation focuses a lot more on the neuromuscular anatomy. I think you end up with a much greater command, I think, of just the human anatomy. Like I said, a lot of the field itself kind of focuses on that in terms of traumatic brain injury, stroke injury, spinal cord injury. We do a lot of diagnostic testing in terms of like EMGs, nerve conduction studies. neuromuscular ultrasound. So I think that aspect of it was much more drawing to me than thinking farther down the line. If I wanted to continue doing sports medicine, what would my clinic look like outside? And I was thinking more of like a family practice clinic versus more of a neuromuscular based clinic, and that was much more enticing to me. So that was ultimately what kind of led me down that path.
Okay, yeah, and I feel like that, like you said, the patient population you work with is a little bit different. I particularly think that the PMNR population, like you said, like the post stroke patients, like seeing them recover to some degree has to be extremely rewarding.
Yeah, definitely. I think it's we have a unique field in that our like system of interest is function itself, and that
Right.
we're trying to restore as much daily function and tailoring our medical treatment for those patients to do such. So it is extremely rewarding, as you said. So a lot of people are very motivated. Um, uh, so it makes for a good field.
Yeah, yeah, and that's a very like inspiring process to be a part of for sure. Are there fellowships available through PMNR, and are you interested in doing any particular fellowships?
Yeah, definitely. So it's a very diverse field. So there's a lot of fellowships. And some of the big ones, a lot of people go into pain. With that, you can do ACGME, pain management. There are physical medicine rehabilitation spots available. They also have a separate match. It's the NAS for interventional spine, musculoskeletal medicine that you can go through. There's neuromuscular medicine in terms of doing electrodiagnostic, EMGs, nerve conduction studies, and ultrasound. Brain injury is a fellowship, and traumatic brain injury. And we see a lot of those patients. A lot of motor vehicle accidents, a lot of falls, a lot of hemorrhagic strokes. So, spinal cord injury is another fellowship that a lot of people go into. There's pediatric rehabilitation. There's other subspecialty certificates or concentrations that you can go into too, in terms of cancer rehabilitation.
Oh,
You can get into specific in terms of like multiple sclerosis, and even Parkinson's. So I think those are the big ones, and I don't think that I'm missing anything. There's cardiopulmonary rehab too.
oh,
Um,
okay. I actually didn't know that you could do that through PMNR. That's cool.
yeah. So
Do you have any idea what you're interested in yet, or not so much?
I think for me, and I don't even know if I mentioned sports medicine. That's another very large one that people go into. So for me, going into it, I was really kind of geared towards that, and um, I think I'm still trying to find my way right now. As a second year, the bulk of our year is inpatient, so I'm getting a large taste of inpatient acute rehab, which is great. Some of the outpatient procedural stuff I think is to come, and it definitely has its draw. I have had a chance to kind of get in and do some of the baclofen clinics and spasticity clinics, and amputee clinics. We do a lot with amputees. Um, so I think ultimately I'm going to want some kind of mix between procedural, outpatient, inpatient. Um, I think it just, the field offers so much. I still haven't quite narrowed it down yet, um, but it's we'll
Yeah, I mean,
see.
there's a lot of the fellowships that sound very enticing, and I feel like I said before, most of them sound very rewarding. So I imagine that it's going to be difficult to pick.
Yeah.
Um, in terms of the match, I feel like I heard that for the fellowship match out of PMNR, it's an early match. Is that correct? You match in your third year instead of your fourth year.
So a typically you start applying in your third year, and
Okay.
you'll match early in your fourth year. And there might be some fellowships in which you do match earlier. The bulk of people though are finding out kind of early August, October of next year, and depending on which match you go into, whether or not you do the NAS or if you do the ACGME match. I know one is now matching, I think 2 or 3 months earlier than the other. So. But you find out very early, so that's what this next year is going to be a buckle down year and try to hone in. So
Yeah, that's fair. I feel like since I'm in internal medicine now, and it's only 3 years, and I can't believe I'm already almost in my second year, and I still am not entirely sure what I want to do. So that's alarming. We're in the same boat.
Yeah.
Um, and also, just going off of that as well, what advice do you have for anyone who's in medical school in their basic science years specifically to enhance their application when they apply for residency for PMNR?
So the biggest thing, and I think the best thing is if you find out early that you're interested in the field, you're going to give yourself a lot of time to do the necessary things. So finding out late, it was definitely a scramble. I think the biggest things are trying to get involved as early as you can. I think that's one of the bigger things in terms of when they polled program directors and what they're looking for in terms of perceived interest in the field is somewhat up there on the list. So getting involved with a lot of those associations in terms of the AAP, the AAPMNR. I think if you can get into the sports medicine conferences as well, really networking, I think, is probably the best thing you can do. I think in terms of one of your questions, usually research. I don't know if you want that now or.
Yeah, you can feel free to talk about it now because everyone asks me about research. So I also ask everyone I interview about research.
Yeah, I think it's one of those things that now it's just important, no matter what you do, to have some kind of academic work or focus. And it's not even that you need to be doing anything groundbreaking or be a part of something massive. Really, just showing that you understand the process. That you're willing to put that extra time in, because medical school is extremely busy. Residency is extremely busy. They want to see that you're able to use that scarce resource of time appropriately and that your interests are there. So I think it's important to try to get on some projects, and it doesn't necessarily have to be physical medicine rehabilitation specific. A lot of my stuff was actually in pediatrics whenever I was at Atlanta Medical Center, just because I gelled with some of those residents at the time, and they said, what are you guys working on? And just you kind of just put the feelers out and grab onto whatever you can. But biggest things, going to the conference, and once you're there, make sure you're showing interest and following up. I think now it's probably more difficult than ever trying to get
I
into
agree. I think in terms of conferences, I think one, they're definitely undervalued by students. Most societies will pay for a medical student's membership. So it's a great thing to be a part of. One, because you can put it on your application under professional memberships. And two, you can go to the conferences, which right now are virtual. So it would be, I wouldn't say it's easy to network because you can't really just walk up to people and kind of just start a conversation. You breakout rooms and all that kind of make that hard. Talking over people on Zoom makes that kind of hard. But a lot of people will on the Zoom conferences will share their Instagram handle or share their Twitter handle, so you can contact them in those ways as well. So I think that's something that can be taken away from both in-person and virtual conferences, is that you can network, and then they usually have sessions for students and residents, so the learning is tailored towards you. It's not all of these fancy groundbreaking presentations that are tailored towards attendings who have been practicing for 10 years. There are things that are tailored towards medical students too, and that is a really good way to start showing that you're interested in that particular field. So I think it's good that you brought that up, because I think people undervalue the opportunity to go to a conference.
No, definitely, and that's why I think it's probably more difficult. That was one of the things that really saved me in terms of my scramble, is going to the conference. So I had made myself little business cards, with my picture and application number on it, and during the fellowship, I think it's the fellowship job fair. A lot of the program directors are there looking for faculty, things like that, and I got there 30 minutes early, and just all the program directors were there. Nobody else was there. I walked around, passed out my card to everybody. And, Dr. Falk was actually, one of the program directors that was there. And, I think he ended up, extending me an interview, and now I'm here, and I selected them as my first choice. So Here's my daughter.
Hello, it's nice to meet you.
I see you too.
Yes, you can.
It's so cute.
Sorry for the interruption.
No, she's cute. I'm glad I got to virtually meet her as well.
She's a cutie. She came to the island with us too. I think she has by the age of 2 had been to 6 different countries, and you know we went to I think second year they had cheap flights from Guadeloupe to go to Paris, so took a
Wow.
quick trip over there with her, and it was a lot of fun. My youngest is going to have a lot of catching up to do. So.
Especially since we have COVID happening right now. She's not going
Yeah,
to be.
exactly. It's so ridiculous.
So kind of deviating just from the questions that I actually have for you, this stimulates, I feel like, a different conversation. I get some questions often about how is it a good idea? Is it not a good idea to have a family on the island? You just mentioned that your daughter was there on the island with you. Can you kind of talk about your experience being a medical student and also having a family on the island?
Yeah, I mean it's extremely difficult. I think you're out of your element. The island that I was on at the time it was Dominica, definitely a developing country. We landed and there was tropical storm Erica had hit just before, had wiped out a good portion of the infrastructure that was there, and that was just a tropical storm. I spent the first, I think, 2 or 3 months, a good portion of the first semester by myself there. My wife and daughter flew down. In terms of safety, I never really, I think we were cautious. I don't think at any point we really felt like we were ever in danger. I think the locals are very supportive, and um, I think they like the presence of the students there. I think we do bring something to their community. Um, it's difficult because I think you're in study mode, you're working hard, you're spending a lot of time in books, and sometimes that is difficult for spouses and families because you're not actively doing anything, but it's a necessary it's a necessary piece of medicine and medical training. So ultimately I think my wife and daughter only spent 2 semesters with me on the island, so um, which was good. I was really glad that they got the experience. My 4th semester, I think, was the least distracted. I did the best in all of my courses, and I think that's when you take your comp exam, and just really didn't have any issues. I got to breeze through that, and took step 1 and was able to knock it all out. Very difficult being away from family, but I think it is good to have that alone time.
Yeah, definitely. Like I can only imagine, like I know being away from my family when I was in Grenada was very, very difficult. Being away from my family, even my friends. You just feel like you're kind of isolated, even though you're, making new friendships while you're on the island. But I cannot imagine how difficult it would be to have a family while I'm in a cubicle all the time. I cannot imagine, especially when they're younger. They're running around. They really want affection, attention, and things like that. So I give you a lot of credit, whether it was for 2 semesters or not. That's impressive.
It was very difficult. It was a very emotional reunion, getting off the plane back in Florida with my daughter, who is they grow like weeds in between 1 and 2. So it was great. I got a lot of good videos of me crying. So
Oh, that's awesome. Yeah, I feel like that makes coming home so much sweeter.
yeah, it did. It was such a difficult thing to go through, but just a very beautiful memory. So
Yeah, absolutely, absolutely. Well, thank you for sharing that with us. I appreciate that. Kind of, I guess, deviating back to our initial conversation, um, in terms of clinical years, what do you feel like helped you, especially since you had to scramble? What do you think helped you improve your application aside of going to that conference?
I mean, I think, just be the sponge we're meant to be. Do the things that you like to do, but don't totally neglect the things that you don't like to do. I've always been just really interested in, anatomy and imaging. I love, MRIs, CTs. I spent a lot of time with the radiologists, no matter what rotation I was on, just trying to become familiar with the studies, how to read the studies, interpret them. Um, I think that helps a lot in terms of, especially PMNR, knowing your neuromuscular anatomy is very important. Um, kind of paying attention to the team. I think a lot of, rehabilitation in general, it does take a lot of different teams to get it working, between your nursing team, your therapists, your case managers. A lot of these patients, have these life-altering injuries where, come out as a T7 Asia A, or then, paraplegic, and now have to figure out how to function, and bowel, bladder management, managing skin breakdown. And a lot of that is going to take, wheelchairs, hospital beds, training for families. So I think there's a lot of pieces that go into it. I think, I just keep doing your best at everything.
No, yeah, that's really valuable advice. I mean, I tell everyone that you should really be performing in your rotations as if you were the intern in that specific specialty. That's how, one, you're going to stand out. Two, you're going to get good letters of recommendation. And three, they're cores for a reason. You have to know you have to know that information. Otherwise, they wouldn't be required. So kind of going back to what we were just talking about a second ago, I know in basic sciences, you mentioned that you didn't really know PMNR was even an option for you. If you had to give advice to someone in basic sciences now who has heard of PMNR but isn't really sure whether or not they're interested in it, what advice do you have for them, or resources that you can share that could possibly get them a little bit more information?
Yeah, so I mean, like I said, both of the societies are great. If you go onto the AAP website or the AAPMNR, they do offer a lot, and kind of like a roadmap to matching, whether it's, roadmap to residency, roadmap to fellowship, and they give you a good breakdown and kind of checklist of milestones you should be meeting. A lot of it is, reaching out and trying to rotate and get in with a physiatrist, just so you're familiar with what we do. Um, it's difficult. I think on the island, you're everything is kind of compounded. All the basic sciences, you're mashed together. You're not really getting that um, intern, or, was it, the year one where you're able to go and shadow maybe and spend some time in offices and do that. But, if you can read about it and just be knowledgeable and sign up for, these societies early, just so that you show that you've had membership for, 4 years, that looks great. If you've got that on there, that you've been a member for your entire time through medical school, that interest in the field is definitely big. Um, I think, focusing on anatomy, focusing on the the surgical type specialties, and I think those are the biggest things that probably help you out through the basic sciences anyway.
Yeah, that's very great advice. When you were saying that you went from third year, you decided at the end of third year that you were now interested in applying to PMNR. Did you get rotations like during fourth year? Were you able to get audition electives or rotations in PMNR, at least to get some letters of recommendation, or did you apply without that experience?
That was one of the probably biggest Achilles heel for me anyway. I had no letters of recommendation from any physiatrist at the time I applied, and I had applied very broadly. I applied to 66 programs, and ultimately I only got 3 interviews. So I thought my odds of matching into PMNR were going to be very slim. I worked hard at making sure that I had kept in contact with all three of my interviews, and I got great feedback from the residents that got to meet with and speak with and kept in close contact with them. And, I got my first choice. So I think I'm very fortunate in that manner. I ended up rotating 2 PMNR rotations, one with University of Louisville, and then one with the it was a SUNY downstate offshoot, but it was through Ross. That one wasn't directly, I guess it wasn't directly with the program. It was one of their side hospitals for the St. John's Episcopals. So it wasn't quite the audition rotation there. Definitely more so for University of Louisville, which was a great program. And I think when it came down to selecting programs and matches, family influence was probably the biggest one. The program at ECU is a 4-year combined program. We've eliminated an additional move. So
yeah, so that brings up a lot of points I actually want to talk about. But first, I am going to stick to the applied to 66 programs, got 3 interviews, still matched at your number 1, because that is 1, amazing, and 2, something I feel a lot of people need to hear, because especially this year, since it's virtual, I feel like the interview theft has been going heavy because people don't have to spend money to travel. And I have gotten reached out to by many people saying they only have between 3 and 5 interviews, and they are freaking out. So I feel like this is the inspiration that a lot of people needed to hear. That is so impressive. And it honestly speaks volumes as to what networking can do for you, especially in this day and age. You met your program director at the conference, you kept in contact with him, you interviewed there, and now you are here, aside of not having any letters from physiatrists. And I can't emphasize networking enough. And this is exactly the point that I needed to kind of just bring it to the top, because a lot of people are really undervaluing that. They're so focused on mostly step scores and research. And like you mentioned, those 2 things will enhance your application, but networking can really go a long way. So congratulations. That's a wonderful story here. Wow.
It was very nerve-wracking.
I can imagine. Did you apply to a backup specialty or just physiatry?
So I ended up applying to a backup specialty. I think, with having a family, the risk of just not matching at all was too much. So I did, and I got many more interviews because I had, letters of recommendations in those specialties. So
excellent.
But the one that I wanted, I did ultimately get a letter of recommendation for our physiatry, and I had saved one open, LR spot for all the programs, and did eventually update my applications. But, I think it's just not having things in on that first day. You really gotta work. It's obviously not impossible, but you definitely gotta work for it.
Yeah, for sure. Especially because we already carry a label, whether we want to be labeled by it or not, but we are labeled as an IMG, which obviously, in a lot of programs' eyes, unfortunately, for unclear reasons still in 2021, takes us down a notch. So that's difficult in itself. In terms of getting letters of recommendation, I imagine that the answer to this is going to be yes, but do you recommend having letters from physiatrists before you apply to PMNR?
Yeah, 1,000%. Probably like I said, it should have been something I thought of from the instant 3rd year. If I could have taken a sick week and gone and rotated at an office just to get a letter of recommendation, I would recommend doing that. Because not having the letter of recommendation, it's a huge hit. And even though you do have the option of updating your application, you really got to take into consideration the sheer number of people applying to these programs, the number of spots they have available. I don't know what it is now, but there's only 450 residency spots for physical medicine and rehabilitation. So many more applicants than that.
Yeah, absolutely. In terms of getting letters of recommendation, what do you think that physiatrists are looking for in medical students to help them stand out so that they can write a letter of recommendation for them so that they have a good one when they're applying, not just in any letter from a physiatrist?
Yeah, I think it being such a collaborative field, you have to be able to work well with your ancillary services. Being able to be approachable, knowledgeable, put in the extra time. There's the joke of physical medicine and rehabilitation stands for plenty of money and relaxation. Um,
That's
it's
nice.
at some point that may be true, but I think in general you should look at it like you got to take things head on, put in the extra time, uh, you know, research, show interest, and just it can be on the topic of the day. If you have a question on something, be proactive and saying, hey, I had a question about this. Do you mind if I look some stuff up and we talk about it tomorrow? That way you're not just fishing for an easy answer. You're kind of showing that you're willing to go put in the work in your own time and be able to see if that translates into applicable knowledge. And you know I think just being genuine.
Yeah, absolutely. I really do think that the whole being proactive thing is important in really any field that you're you plan to apply for and you want a letter of recommendation. And that's something that most attendings are looking for in any medical student is it really shows your interest. If you come back the next day with the answer, you cared enough to look it up. If you don't ever come back with the answer, that means you're probably not looking anything up. And how interested are you? They're going to question that. So I definitely think that's a good point that you bring up. In terms of the no letters of recommendation, I looked up the average step score for PMNR. Looks like it's about a 228, 230, so pretty competitive. How did you do in relation to the average step score?
So for step one, I did terrible. It was I was definitely below. I think I was in terms of the curve for matching somewhere in the 25 percentile. If the 50 percentile is that 280. I ended up doing much better on step two, and I think that was just a huge help. I think in general, when I was looking at, I was trying to look up some stuff too for this, and the program directors, what they're looking for, the step scores, most of them weigh step two a little bit higher than step one, which was great for me. And, I think showing that dedication and advancement, it's not another, it doesn't mean a no, if you do terrible on step one. So I had a lot of things going against me for the beginning of it. A less than average step one score, and no letters. But
yeah, and I think this is a great example of what people once they do poorly on step one, they are convinced that they will never match ever. They will not even soap into a position. Like it's just completely game over. But like you mentioned, most programs are starting to look at step two CK more anyways because it's way more clinical and it reflects a lot better on where you stand with your clinical knowledge. That's why it's called CK when you become a resident. So I think it, one, speaks more volumes, and two, step one is going pass fail anyways, so programs should be looking at step two CK anyways.
Yeah, exactly.
But I'm not a program, so that doesn't matter.
I would have been very happy with a pass and just my step two score.
Yeah, exactly. And this is what I say. I've been saying like a lot more frequently just because now it is becoming pass fail. I think it's a good thing because that's what it was meant to be anyways. It was meant to be if you get this 192, 194, 196, they keep changing it, and you pass, that's all you need to practice medicine.
Yeah.
The difference between a 196 and a 270 isn't supposed to mean anything. And somehow we have gotten into this downward spiral as to where it becomes a filter and not just a threshold that you need to practice medicine. So in my opinion, it's probably a good thing that it's going away.
And no, it is not. I hope it'll help.
Yeah. I'm trying to think of what else I have for you. Interview trail. What was your most commonly asked question for physiatry?
Really, it was for me. It was tell me about yourself, and I think that's one that even for my secondary specialty too. In general, if you're invited to an interview at a program, at that point you've met all of their boxes to be at that program. I think from that point on, you're really just trying to show that you're going to be a good fit at that program. You're going to work hard at the program. Um, you're going to be receptive to teaching and that you have a good genuine interest in being there. So I think that was it. Just kind of tell me about yourself and why you want to do physiatry and what's important to you. So
Yeah, no, I mean, and that was the same case on my interviews, and that's been the same case for pretty much everyone I've interviewed so far, regardless of specialty. They're always the three most commonly asked questions because realistically, they serve as the best filter. If you aren't passionate about it, they can tell. If you're just doing it for either the money or the lifestyle, they can sense that through those questions. They've been doing this for a very long time. So, to my knowledge, correct me if I'm wrong, PMNR is a 4-year residency.
Yeah.
3 years of actual PMNR, and 1 year, your PGY 1 year is a preliminary year.
Exactly.
Does this have to be in internal medicine, or can it be in either a transitional year or a preliminary year in surgery?
Yeah, so it is. It's an advanced program. So you start, PGY 2 is my, intern year for the specialty. So you can, some programs, my particular program is a combined program. I got to do more of a transitional year where I got to do surgical, 5 months of surgical specialties and 7 months of, medicine or rehab specialty based rotations. A lot of programs that don't have an incorporated PGY 1 year, they'll accept a prelim year in medicine, a prelim year in surgery, or a transitional year. So I've heard advantages to all three, and I've heard disadvantages to all three. I think in general, surgical prelim years, you have to be careful that you're not going to a program that you're going to be taken advantage of, as the intern, that you're actually going to get some training there, and you're not going to be somebody there that's just doing the grunt work. In terms of inpatient medicine for medicine prelim years, you can spend 11 months doing inpatient medicine, which I'm sure is a very taxing ask. In the same token, once you get to your specialty, physical medicine rehabilitation, it's just you. For me, you're making medical decisions. That first year of medical based rotations is going to see you through for the next 3 years of your specialty training. So you need to retain, make sure that you can manage heart failure, respiratory failure, that you can manage these long-term chronic conditions, COPD, hypertension, diabetes. All these things are still ubiquitous through physiatry, but you need to make sure you hone those skills in that first year. So I think finding a program that's going to do that without beating you up too much, if you can do that, that's the trick.
Yeah, for sure. For sure. Were all of your programs advanced, or were some of them, meaning they have only the PGY 2 through PGY 4 position for PMNR without the PGY 1 year bundled in? You have to find that somewhere else. Or were most of them categorical, where your PGY 1 year for preliminary was included with your PGY 2 through PGY 4 year?
I think it was about 25% were categorical, and about 75% were the advanced placement, where you had to source a prelim year. So.
And did you find since I know that now that you didn't have any physiatrist letters, did you have letters for the preliminary spots that you were applying for physiatry?
I did, yes, yeah.
Okay.
So I had surgical letters. I had letters from internal medicine, family medicine. I had a really great letter from a pathologist that I rotated with in Atlanta too. I had a really great rotation with him, and he wrote me a great letter And I used it for a lot of my rotations, and I just knew that he would write me a good letter, so I just always
Yeah.
threw it in there, and everybody always commented and said, why did you have a pathologist?"
I was just about to ask you the same question, because I think that just hearing that alone, I feel like would make you a well-rounded applicant, because you're doing things outside one of the norm. Most people do not, unless they're interested in path, don't choose to do an elective in path. And
Yeah.
two, it really shows you all aspects of medicine. And I think
Yeah.
that's really important. And I think that is, I keep saying things that are undervalued by medical students, but I do think that everyone tries to they focus on the areas they know they're interested in or they know that they're good at, and they usually fail to do something they either don't want to or need to strengthen. So I think that that's just a sidebar that you kind of brought up. That's also very important to convey as well. If you don't mind me asking, why did you do an elective in pathology?
So, at Atlanta Medical Center for our school, and as you know, with Caribbean schools, sometimes it's difficult to get electives.
Yeah.
Um, it was, for me, it was a rotation that I would still be able to get some of that gross anatomy. I did actually get to go into the cadaver. So they had the autopsy there, where the medical examiner for the state would come and be there present for the autopsies. So and then I think also just going through and getting to do some of the pathology and seeing the pathologies. I think the other thing too was I was studying for step 2 at the time, and it was a rotation that was confined to daytime hours and allowed for good study habits.
Conducive to good study habits. Yeah, that's definitely not a bad answer, because there are those rotations are very far and few between. So you were looking for a program that was going to be good training to become a great physiatrist and get you to your end goal, whichever that becomes, whichever fellowship you decide to pursue, if you decide to pursue one. Were you also, how much were you taking into consideration the either area or atmosphere or environment for your family, since it's really not just you who would be moving, it was your entire family?
Yeah, I mean, I think for me it was a huge component of it. My wife's name is Erin. I felt like she had sacrificed a lot, in allowing me to go to school, moving. She had moved away from her work, her friends. Ended up moving back with my daughter, raising her there with my help with my parents at the time there. So it was very difficult, and I felt like she deserved a big say and where we would be spending the next 4 years of our lives. So um, she's a Florida girl, and East Carolina is near the water. It's also a program that offered a 4-year spot to land. I think the hospital itself gave me everything that I needed. A lot of inpatient rehab experience. You can go back and forth in terms of whether or not having fellowships is a good, plus or a minus. I think one of the pluses for me, we don't have any associated fellowships here for PM&R. We also don't have an anesthesiology department in terms of so we get to do a lot of interventional procedures, and a huge majority of our, at least in the last several years, have gone into interventional pain. You get a lot of great experience in that manner. I think also the inpatient acute rehab hospital here is, we have a 55-bed acute rehab. There's 5 residents that manage it. We each take a service that ranges anywhere between 8 and sometimes as many 16 patients on it. So by the end of PGY 2 year, every single one of them was saying they felt very comfortable being able to manage. They could go straight into practice, and I think the next 2 years we get a lot of great outpatient experience. And it, any fellowship that when I was speaking with the residents, any fellowship that anybody wanted, nobody wasn't able to get it. So we
Right.
place people in pediatric fellowships, we place people in brain injury fellowships several years back that, and I don't think we've had interest there, but spinal cord injury as well. So
yeah, and that alone has its own benefits too, because I feel like often, it's definitely good to be looking for in a program if they have fellowships that they offer themselves, and whether or not people choose to stay. I think that reflects a lot on a program in itself. It reflects a lot on the culture for sure if people are willing to stay. But also by not having fellowships at your institution, it allows your network to grow. So every year, how many people are are in a graduating class for PMR? Not many, right?
For us, we have 5. We send 5 out every year. So
5, right? So 5 every year. 5 people match at a variety of different places and a variety of different subspecialties. And I feel like that allows the network to grow a little bit. And then you have people everywhere, and it allows, again, connections and networking to be a little bit easier that way.
Yeah, absolutely.
Rather than if the institution was just retaining those residents as fellows.
Yeah.
So I don't think I have any other questions for you. Do you have any advice that you think would be very helpful to medical students? If so, please feel free to share.
I think that was just about everything on the list. So enjoy the process. I think, for everybody, it's extremely nerve-wracking, stressful time. You put so much time, effort, and more money than you ever wanted to into it.
Very true.
Always so much easier to say it on this side of the road, but telling everybody just hang in there, and sometimes you got to hear no a couple of times before you get a yes. So we've had multiple people that for physiatry in general that maybe don't match into it. Still doesn't necessarily mean that you're not going to be able to go into it. So it's a great field, though. I hope if anybody has any questions or does want to reach out to me, they're more than welcome to.
Excellent. Well, that was a very good closing statement. So I think I won't say anything else. We'll just end it there. So thank you so much for taking the time to share with us your wonderful journey and your very inspiring story. And congratulations for being a father and a husband, as well as a medical student and a resident. It's a lot all at once. You are a champ.